So many of our clients come in, they have a lot of pain and inflammation, whether it's due to post-surgical issues, arthritis, such things like spinal stenosis or herniated disc. What the pool does for these people is it's giving them an opportunity to move. Some of the other clients that come in have neurological diagnoses or may have weakness due to a stroke or a spinal cord injury, a traumatic brain injury, MS, Guillain-Barre syndrome. And what we see on land is that they can't move so well on land. They have poor exercise tolerance. So as a therapist, our goals are going to be allowing this person to move in a safe environment, to allow them to move in correct, safe, functional movement patterns, and to have less pain.
There are so many therapeutic benefits of exercise and water. Decreased pain, increased strength of extremities and core muscles, increased balance and coordination, decreased spasms and spasticity, increased body awareness, as well as functional gains such as gait, stairs ability, and standing tolerance. Psychological benefits of exercise and water are numerous and can greatly improve quality of life. In the water, some people are able to walk or stand with increased posture, but they can't do these tasks out of the water at all or as long. With aquatic therapy, the body learns to move again, and that can carry over onto land. The body remembers what it feels like to move normally.
So in the water, one of the biggest perks is the property of buoyancy. So if someone is just standing in waist-deep water, they are 50% weight-bearing through their feet. They start walking fast, they're about 75% weight-bearing. But this is huge. They feel safer. They are allowed to take bigger steps. As they submerge in the water up to their neck, they're maybe only 10% weight-bearing through their feet. Where on land, they're going to get huge compressive forces through their knees and their hips, which may create pain. One situation I had someone come observe who was a neuro resident from Yale, and I had all my patients walking in the water, and I came over and I said, wow, you know, every single person in the water right now doesn't walk on land, yet they're walking back and forth in the water. My job is to set them up, make sure they're safe, put the correct equipment on them so they're not going underwater, whether it's buoyancy, flotation devices, weights on their feet to keep them in vertical position. Spinal cord patients that come in, we can teach them how to swim laps, do recoveries. They can be in a vertical position probably sooner than they can on land because of the hydrostatic pressure of the water. It's a gradient pressure from the deepest depth all the way up to support their blood pressure so it doesn't drop. If they have an incomplete injury and have some volitional movement, great place to start walking. I have some patients that can flex their hips but not extend. So we set them up with the weights and the floats and they can go back and forth and walk. So it's an amazing arena to support all these diagnoses.
Many people achieve relaxation due to the warmth and buoyancy of the water. With reduced or absent pain, there's increased movement, which results in increased flexibility and decreased swelling of extremities. When cardiovascular exercises are performed, such as resisted arm and leg exercises, deep water running, plyometrics, or swimming, there is carryover of increased heart and respiratory rate with improved circulation. There is realization of decreased fear of re-injury and quicker recovery for return to sports or to work when combined with land-based treatment. It's easy to see that there is increased freedom of movement in water, which can result in decreased depression. The water provides a setting where people feel free to move. It may be the first time they can move with little or absent pain, or where they can actually move independently. This sense of freedom cannot be matched in any other setting. Aquatic therapists at Gaylord receive special training in aquatic therapy. Physical therapists and occupational therapists are knowledgeable in the physical properties of water and its therapeutic benefits, allowing water exercises to be made harder and challenging or easier, depending on their needs. Therapists at Gaylord have 20+ years of experience treating in aquatic therapy, working with all types of diagnoses and functional abilities. The aquatic therapists at Gaylord attend continuing education classes to learn advanced aquatic techniques such as Badragaz, Haloic, I Chi, and Watsu. The staff is also lifeguard trained to ensure a high level of safety in the aquatic setting.
Obviously, we live on land and not water. Some people and many patients want to live in the water. Unfortunately, we can't do that, but it's an amazing way to support their goals.